everybody, and welcome to this edition of All Things Cancer. And today we have a guest that I'm very honored to introduce. It's Dr. Heather Paulson, and she is a naturopathic oncologist, a naturopathic doctor specializing in oncology, which is super for our community here today. And why don't I start by reading your quick bio so everyone knows your background, and then we can delve right into the interview. Is that okay?
Sounds good. Yeah, sounds great.
Dr. Heather Paulson is board certified in naturopathic oncology and author of the soon-to-be released textbook of naturopathic oncology. She integrates her specialization in cancer and her love of nutrition, herbs, homeopathy, counseling, traditional healing, energy medicine, and current research to support you during your cancer journey and for cancer prevention. Dr. Paulson's caring and warm approach makes her easy to talk to, and she enjoys answering your questions. Dr. Paulson is in private practice at the Paulson Center for Integrative Healing. In addition to private practice, she loves teaching oncology at Southwest College of Naturopathic Medicine. Dr. Heather Paulson looks forward to connecting with you at www.drheatherpaulson.com, and we can repeat that at the end as well. So welcome, and over to you, Dr. Paulson. So the first question is, what made you decide to specialize in naturopathic oncology?
Yeah, thanks for having me here today. I'm so excited to talk with everyone that's listening or watching. Like many of you who are listening or watching, I got into naturopathic oncology because of personal experience with cancer. So that's really what started my journey. Is my dad was diagnosed with colon cancer when I was in college, an undergrad, and I became the resident cancer expert for my family because, as people probably know, it's very hard to understand what's going on once you've been diagnosed with cancer. It's a whole new language, it's a whole new vocabulary. And even though I was studying marine biology at the time, of all of the people in my family, I was the one who could best translate the words that the doctors were using. And I was well trained as a marine biologist in how to use the research library and look things up, and how to develop research studies myself. So I spent a lot of time in the marine biology library as well as in the medical library trying to figure out what was going on with my dad's diagnosis.
Yes, I know. I hear you loud and clearly. I mean, most of us have had that adventure either with ourselves or with a family member. And indeed, it does become like that. You do become quite an expert as you try and navigate your way through that. And depending on not how, in your case, your father, he probably must have been very grateful to have you by his side.
Yeah, I mean, I think my other families had a hard time taking advice from a 19-year-old about something so serious. But my dad always honored my opinion and was really grateful for the research that I did. I think what actually spurred me on to go to medical school is that I loved marine biology. That's what I wanted. That was my passion in my life. And I decided to go to medical school because I was the first one to tell my dad, out of all of the doctors that he was going to and everybody that he was speaking with, that he had stage 4 cancer, that his chemo had a 12% chance of working or less. And I just felt like there was a missing piece in communication between physicians who specialize in cancer care and their patients going through the cancer experience. So I decided the best way to fill that gap was to get the official degree, learn the language, learn the lay of the land in oncology. And that's what I did my residency in a hospital so that I could really learn what it's like to be part of an integrative cancer center and bring that knowledge back to my private practice and to my patients.
That's awesome. Absolutely awesome how you combined that so that you also have the necessary credibility and authority to be on a par with the conventional doctors. So So tell us, tell the community a little bit, describe what you do in your practice. What can they expect if somebody's just been diagnosed with cancer and you're looking for options, choices. You might have been to a conventional doctor, but you've been told surgery or chemo, radiation, and you're looking for other options, alternatives, just to be able to make an informed decision.
Sure. There's a lot of different ways that I work one-on-one with people, and it's really about where they're coming into the appointment from. My number one priority as a naturopathic oncologist is the principal doctor as teacher. That's one of the principles of naturopathic medicine. And so I take that role as teacher very, very seriously. And we talk about everything. We go over your path reports together. I make highlights and circles, and just to make sure that you understand everything that's been talked about with other providers. Because sometimes, either because we're overwhelmed or the language is confusing, we don't even know what's really going on, right? So that can be scary and frustrating. So I just make sure that we all have a common language first and really get to know your personal health history. Because I think that cancer is different from person to person to person.
Yes. Oh,
and
yes.
Yeah, I don't want to just like focus on the tumor. I want to know about you and what your environmental exposures are. What are your main stressors? How is your emotional health? And that gives me a full picture of all the different things that can contribute to cancer. Then we talk about what to do about those things. So do we need to change your diet, or is your diet already on a good track? Do we need to talk about meditation and mindfulness practices because you're under a lot of stress? Do we need to integrate some herbs, some botanicals, some natural supplements to block your tumor growth? And how are we going to integrate with conventional treatment? Are you going to choose to stay with chemo, radiation, and surgery, which I'm a fan of? That's what I recommend to a lot of my friends and family members who are going through cancer. Or are you going to choose completely alternative medicine? And mostly what I do with people is do something in between. So making sure that we're using the best of the things that kill cancer cells rapidly, which is chemo, or get rid of the cancer quickly, which is surgery, or while integrating the natural therapies. So I don't feel like somebody's cancer journey has to be either natural medicine or conventional medicine, that there's a bridge that we can build between the two.
I love hearing that. That is just exactly the way it is, because we're all different. Our cancers are very different, and our financial situation is often very different too. So there has to be these alternatives open. So I can hear through this that you probably then work together with conventional oncology. Can I understand that correctly? And they obviously respect you because of your medical background?
Absolutely. So that's one of the blessings that I have in the work that I do is and especially here in Arizona, I have several oncologists that refer to my office that are interested in what I'm doing, that want to learn what we're doing here because they're seeing their patients get better results when they're working with me. And even there are times that we do natural medicine by itself and my patients continue to be monitored by their oncologist, and they're seeing results. And I had an oncologist reach out to me because 2 times we were able to, with natural medicine by itself, we were able to have a patient go into remission from their disease.
Okay.
Which was awesome, right?
Yes,
and
yes, absolutely.
So they clamored for my information. They hadn't reached out to me prior to the second time that it went into remission. And the in-between time between those 2 remissions, she kind of like slacked on her diet and slacked on some of her supplements and stuff. So we just tightened things back up and we were able to go into remission again. And same with another patient that had ovarian cancer. She wasn't responding to chemotherapy anymore. She was on kind of a consistent chronic dose of chemo to keep her ovarian cancer in check, and her tumor markers were going up. And we added some more natural therapies, and her tumor markers came into the lowest they've ever been, even when she was responding the best to chemo. So of course I have great relationships with these oncologists who are like, what are you doing?
Yes.
And she continues to do some of the chemotherapies that she was doing before, but just at lower dosages. But like I said, she wasn't
Which helps,
responding.
of course. Yes, yes.
Yes.
So the fine line often then between evidence-based, the more conventional route compared to then what sometimes I face, I'm just a nutritionist supporting people going through treatments, very often trying to mitigate the side effects. And sometimes, we have to be a bit careful with certain oncologists because they're just not familiar with the recommendations we make with either botanicals or with supplements, that we make sure that they will not interfere with the interaction of the chemotherapy or the radiation, of course, because that's the most important priority, is make sure that the treatment is effective. Do you ever have that kind of, how should I call that? I think
like a little
pushback, caution, lack of education, lack of understanding. I mean, we have to respect where everyone's coming from. But if people are not familiar to, for example, working with a naturopathic oncologist like that, do you have that ever, or not so much?
Sure. Of course I do. And the way that I always explain this to the people that I am working with is that I don't expect the rest of their cancer team to understand or even have a desire to understand what we're doing together, because that's not their specialty. Just like I don't know all of the drugs that are coming down the pipeline. I'm not talking to drug reps on a daily basis, or I'm not up on some of the information that their oncologist knows. And there's potentials for knowledge gaps in what I do in my practice as well. And my approach to that is just education. Again, doctor is teacher, and really being open in my communication with other doctors. So that's what I do. I just share my notes. And if they have questions about my chart notes, or if they have questions about what I'm doing, or they start talking negatively about what I'm doing with the patients, I first of all just cheer my patients on and say, look, it's okay. Like, it's okay that they don't necessarily understand this. Here's the information that makes this really safe. And then I just provide tons of research studies, because even though we don't have the same level of large clinical trials as the oncologist might have about their drug therapy, we still have clinical trials that show acetyl L-carnitine reduces heart damage from adriamycin, Cytoxan, Taxol. I mean, that's published. Those are published studies. Like, you can't argue with that information. So I feel really good about just having an open conversation. I think my time in the hospital prepared me for that, because whenever we presented a treatment plan, we were part of an integrative team. So several times a week, almost every single day, we met as a team with myself, a medical oncologist, a radiation oncologist, a surgical oncologist, and we discussed every single case and why I was recommending the things I was recommending. So I'm used to the hot seat. It's not an uncomfortable position for me to be in. And I've learned the studies that are really good for those conversations. And it comes in handy, because like right now I have a patient who has a family member that's a radiologist, and he has not been open to natural medicine in the past. And my kind of approach with like, okay, we're going to start with these really safe things. We're not going to go directly into IV therapies. Let's just kind of like dip our toe into the natural medicine pool here. And showing him the research has gone a really long way. And I think it's just about not being confrontational and being curious about what their questions are, and then just answering those questions.
Yes, absolutely. I totally agree. And I think the cancer patients, if they are in that kind of relationship, that what a gem to have that kind of support from both sides. That sounds really awesome. Now, you mentioned IV therapy, so that obviously is one strategy that you offer support in. Can you explain a little bit about that?
Absolutely. So we use, as naturopathic oncologists, we use IV nutrients as one way to help block tumor growth, or just to help the body recover from chemotherapy, radiation, or surgery. And our different IV recommendations would be tailor to what your body's going through. So I have different IVs for women recovering from mastectomies that help reduce swelling and improve wound healing. And then I have different IVs for someone who wants to use a nutrient to help block their tumor growth. And so we just tailor it to the need.
Okay. And is that covered by health insurance? The all important question, services that you provide overall, are they covered by health insurance?
So the IV therapies for the most part are not covered by health insurance. Health insurance, health insurance is getting better and better at covering my in-person visits. So anytime I'm doing a follow-up appointment or a new patient visit, they're getting better at covering that. But I consult with people all over the world and through platforms like we're using right now to have this conversation. And that obviously isn't covered by insurance. And I'm not working in the capacity as a physician. I'm consulting with people.
Okay. So that leads me into the next question, which is great. You're opening all these doors. So people can work with you either in person, obviously, if they live locally, because you have a center for healing, or they can work with you virtually. And can you explain how does that look like?
Yeah, well, if you come in person, I love having people here in person. I'll greet you with a cup of tea and we'll sit down and chat at literally our family's kitchen table, because I've always wanted to practice kitchen table medicine, where we're just gathering together to discuss what's going on with you in a really knowledgeable but casual kind of way, and welcoming. If you work with me over a virtual consult like this, then we meet, we talk. I'll still probably be drinking tea, and you're welcome to pour a cup of tea as well. It's actually in my portal's message while you're waiting for me to pop in there. Like, please pour a cup of tea, get ready for our little chat here. But I do require that people continue to work with their doctors locally, since I can't have my hands on you or touch you or make sure that I can't order labs or scans or any of those things that I do here in person. You absolutely have to have an oncologist and someone monitoring you locally, so that I can truly just be a consultant and not the doctor of the case.
Sure.
And then to bridge that gap, I've started to do retreats, because I do have so many patients that are long distance and I want to physically see them. There's just so much more power in being in each other's presence, I think.
Yes.
And so that's kind of the gap builder that I'm instituting this year, actually, is to start having more in-person retreats so that people can travel, get connected, and go back home.
What an exciting idea. Because, and that will be for cancer patients across the spectrum, or do they have to be at a certain stage in their cancer journey?
Yeah, so at this moment, we're starting with cancer survivors. So people who have completed chemo and radiation and surgery, or are in remission, or are in a space where their cancer is pretty stable, mostly because of travel, right? It's hard to travel when you're actively going through treatment. I know that from my husband's cancer treatments. When he was going through chemo, we just hunkered down in our house. We weren't going anywhere. So that's why we're starting with cancer survivors, but I can see us opening up to people in a variety of stages in the future.
And do you have it locally, these retreats?
Yeah, so we're starting to have them actually in my office. So my office is big enough to host up to 15 people. So we're keeping it intimate and small so that everybody gets individual time. But you also are in a really safe medical setting. I was looking all around to find like the perfect place, and looked at so many different resorts and health centers all over, because here in Arizona, we have an abundance of like spas and resorts. Mm-hmm. And with people who have health conditions, I just wanted to feel safe and in really taking care of them. So I thought my office was the right place for that.
Okay. And how long is such a retreat? Do you want to elaborate on that a little bit?
Sure. Yeah. So they're gonna vary. They're anywhere from 3 days long, 3 to 4 days long, for our more one-on-one retreats where it's limited to 6 to 10 people, and we really dive into everybody's individual health concerns. So those are a little bit shorter, but a little bit more intense. And then we have longer retreats, which will be detox or cleanse retreats, where for 5 days, you'll be getting everything that you need to cleanse. So we'll be doing saunas and body wraps and massage, acupuncture,
Wow.
hydrotherapy, IVs, all in a medical setting, so that so that's safe, because I see so many people trying to do detoxes on their own.
Yes.
And I'm always kind of like, ooh. Like,
yes, that's a very, very, very touchy subject. I have many of my clients say the same thing. Do you offer detoxes? It's like, ooh, with cancer, you got to be very careful what you let loose. You can unleash forces here that has to be monitored and supervised. So you have all those facilities in your office. A sauna? Yeah. Is it a far infrared sauna facility?
It's an infrared sauna, but it's one of those really awesome fold up saunas that you zip yourself into.
Yes.
I looked high and low for the right sauna, and I've been actually looking for years for the right sauna, and I've looked at the big units, and we had space in my office to do a bigger unit. But then I came across this particular sauna, and I loved it because it actually uses green tourmaline, the stone, as what carries.
It's in my ring.
Oh, yes.
That I'm not wearing right now, but my engagement ring is a green tourmaline. Funny.
Yeah. So, and it's a very healing stone, green tourmaline. And that's what the stone that they use to carry this infrared heat throughout the entire sauna. And I just thought, wow, that's kind of brilliant. So I went with the zip up sauna that you sit inside of.
And how can you describe a little bit, people, viewers or readers that are not familiar with why this type of sauna is good for detoxing from cancer or even cancer treatments?
Absolutely. That's such a great question, because I think sauna is so underrepresented and so underutilized as a general therapy. And the reason why we love sauna here in this office is because infrared sauna in particular is getting into your fat cells and helping mobilize things from the fat. The reason why that's important for cancer survivors, or I wouldn't recommend it during cancer treatment. It's a little bit too exhausting. You're already tired. But after cancer treatment, it's important because some of those chemotherapeutics, they get stored in your fat cells, and they get stored in your muscle and in your bones. So for one thing, it helps mobilize the things that are stored. Another thing is that when you are stimulating those fat cells, you're helping balance your hormones. So for cancers that are hormone sensitive, that can be very helpful. And then lastly, our fat cells, I think of them as like our savings account of all the chemical toxins that we've been exposed to. Yeah. So
that's a good way of looking at it. Yeah.
Yeah. So our body's not stupid. It sees all these toxins that we're breathing in from our air, that we're taking in through our skin when we're cleaning our house, from everywhere that we're exposed to these environmental pollutants. It says, oh, wow, that could really damage my liver. Oh, wow, that could really damage the kidneys. I think we should store this somewhere where it's not going to hurt anybody. And so it just packages it up and stores it in your fat cells so that it doesn't damage anything. So what happens with the sauna, there's been research studies that looked at the firefighters from 9/11, or some of the rescue workers from 9/11, who were experiencing what was called 9/11 syndrome. I don't know if you remember with 9/11, the firefighters and other service workers were having terrible illnesses from inhaling all the dust that they were running through during that time. And it was full of heavy metals and solvents, all of those things in between our walls for insulation, all these things that they were breathing in. And they found that when they put these rescue workers into a sauna, that they started to feel better. And then they started testing their sweat droplets to see what was in their sweat. And they were sweating out heavy metals, solvents,
Wow.
pesticides.
Okay. That's
So
a powerful research. Yes.
Yeah. So it actually mobilizes things. And that's another reason why when you sauna, you want to make sure you wipe your sweat off.
Yes, get rid of it. Otherwise it gets absorbed again.
Right. Yeah. So it's a very powerful tool.
And how many treatments do you generally offer from, if someone comes to you, is done with cancer treatments and says, all right, as one of the strategies I can use to help detox from these treatments are sessions in this type of sauna. What is your general recommendation here, and how long it kind of takes to have effective detoxification show up?
Yeah, that's a great question. So my general recommendation is to do 2 to 3 saunas a week for at least a month to 3 months, kind of depending on their baseline toxic level. So if we're talking about just someone who's gone through conventional cancer treatments and that's their main toxic exposure, it'd probably be for a month. But if we're talking about somebody like I've had patients with breast cancer that used to work in a cosmetics factory, then we'd be talking about 3 months. So it depends on their previous environmental exposures.
Sure. And how do you test for that? Or is it just through asking questions in terms of what they were exposed to beforehand?
Yeah, so we definitely ask questions, dive into their environmental exposures. It's part of my questionnaires that people fill out before they even come to the office. And also we do some testing, and there's ways to test it in the urine and in the blood. You can test different toxins and see how your body's metabolizing them, if it's metabolizing them or not. So that's usually what we use here.
Okay, awesome. Such wonderful information for the community. That's really great. Cool. So I wanted to touch a little bit, we're nearly out of time, but I wanted to touch a little bit also on, you had mentioned that you are teaching, and you also mentioned in your bio that a book is about to be released. So do you want to talk a little bit about your teaching?
Sure. I teaching, as I've said throughout this discussion, this conversation that we're having, is one of my passions. And I am always teaching, whether it's to naturopathic students. I teach other physicians and commonly featured in lecture series and things to help teach other doctors. And then I love teaching here like this. So to anybody who will listen to me, I will talk about naturopathic oncology. Basically is what it comes down to. But with students, it's really an awesome way to help form and touch how naturopathic oncology moves forward in the future. And it's just really fun. I teach lecture courses in oncology, and then I also teach a clinic shift where the students are responsible for talking and working with the patients with cancer, and I'm overseeing them. Okay. And it's really a beautiful thing, because for the most part in naturopathic medicine, we're working with fairly healthy people, and in cancer, with everything that people are going through, it's a little bit of a different situation than someone who has gas and bloating, so it really helps expose the students to having a little more empathy and compassion. Yes. And to get used to seeing people who are sick and who are going to rally from that illness and get better. So it's just a really cool thing to be a part of.
And that's your passion.
That's my passion. Yes.
And why is this your passion? Is it just basically because, picking up from what you had said earlier on, which is, I think, often the passion for many of us, why we are in this integrative healthcare environment, is we see someone we love or even ourselves suffer. And we say there's got to be a different way. There's got to be other ways to look at that. So I'm just making this up because that holds true for me. But what is your passion? Why is this your passion?
There's just so many reasons why I'm passionate about oncology. But I'm passionate about supporting people with cancer because I've been in that gap space of trying to figure it out on your own, trying to read all of the blogs and books and everything that's out there and make sense of it all. And it's just really overwhelming. Yes. One of the things that happened And my first year of naturopathic school when I was a student was that my husband was diagnosed with cancer. And that really shaped things for me as well. I had already gone there because of my dad dying of colon cancer. And then this happened with my husband. And I had a couple of realizations. One is that my husband would not let me give him medical advice. And it ended up being the best blessing ever. I mean, at the time I kind of fought it, as any significant other probably would. But it ended up being a huge blessing, because what he said to me, he's very eloquent and evolved, I think, more than I probably give him credit for. He said, I want you to be my partner in this and not my doctor. And that's true. Those are different roles, to be a loved one, to be a support person, to be a co-survivor is so different than being the person who's holding up the medical care. So that's part of why I'm passionate about what I do, is I see my job as taking the stress and the burden off of the friends and family members that are like combing the internet, sending emails, off of the patient who's trying to be proactive for their own health because their other doctors don't understand what's going on. So that's part of it. The teaching part, I'm passionate about that, because when my husband was diagnosed with cancer and I was in naturopathic school, I got actually a little shunned in my school for letting my husband do chemotherapy.
Do treatments. Okay.
Yeah. And I thought that was, one, very disappointing. And I would be disappointed with a medical oncologist who wouldn't let someone do natural therapies. And I'd be equally disappointed with my naturopathic colleagues who shunned somebody who needs help and support for doing conventional treatments. And I literally would get in arguments in the hallway as people attacked me about my husband's choices. They're not even my choices. It's his choice, what he does with his body. And the thing is, it's like with his cancer type, chemotherapy had a greater than 98% 10-year survival rate. It would be irresponsible for any doctor to advise against that treatment, statistically speaking. So that's why I stand up in front of naturopathic students and other doctors on a regular basis, because I want them to be open to there not being only one way. So I stand up in front of medical doctors and talk about natural medicine, and I stand in front of natural doctors and talk about chemotherapy, because I just want people to have the best of whatever is available. Because if we had cancer figured out, we would all know it, and nobody has this disease completely figured out. So that's where my passion bubbles up from.
What an awesome response. And you speak directly from my heart. I so agree. It is so complex and so multi-layered and so individual as well. There is just not one quick fix, and you have to address the different modalities. And I think just having somebody like you on the team is just awesome, because there is that respect. We have to mutually respect each other. For our strengths, but also for our limitations. And I think we need to own up where our level of expertise kind of reaches its limit, and where we have to include somebody else on the team. And I think the bottom line is so important, is dealing with, you need a team approach to deal with that. And you, as the patient, the one affected, is absolutely full on part of that team.
You're the hub of the team. You're the most important part of that team.
Correct.
And everybody else on that team should be respecting your wishes, your desires. It's like I said with my husband, it's his body, it's his choice. Same with anybody else that's listening to this or watching this. It's your body, it's your choice. And whatever empowers you to overcome the health challenges that you're experiencing, you should do that.
That is it. That's your way. Yeah. So lastly, I mean, I could talk for hours with you, but lastly, I think you mentioned, so you have an upcoming book. So do you want to tell the readers a little bit about that?
Yeah, it's super naturopathic oncology nerdery, as what I like to refer to it as.
Which I'd love. I can't wait.
Yeah, so I'm co-writing the textbook of naturopathic oncology and integrative oncology with one of my colleagues that practices in Canada, Dr. Dan Lander. And we're really excited. We both teach oncology. to physicians and to naturopathic students. And we're really excited to have a really good reference for the medical practices. There's some good references out there for patients at this time. Some of our colleagues have written some really great books, but there's no textbook on functional oncology or functional medicine approach to oncology, naturopathic approach to oncology. And that's what we're doing. So
when is it due to be released?
Oh my gosh. Well, our editors and publishers would like it to be released. It'll be released at the end of 2017 at the latest. We're aiming for summer. So we'll see how all the writing and editing goes from here, but definitely in 2017.
Can't wait. And we'll definitely, promote that within the Anti-Cancer Club community. That's such an important tool to have. So
yeah, thank you.
And very, very lastly, where can people find you and contact you if they want to get in touch with you?
Yeah, so it's really easy to find me on my website. So my website is www.drheatherpaulson.com. So it's just my name. And I would be more than happy to support you. I'm on Facebook, Instagram, Pinterest, wherever you are. I'm trying to sprinkle knowledge about naturopathic oncology, natural cancer solutions, and provide support for people who need it.
Great. And I just want to add in the spelling of your last name, because Paulson can sometimes be a discrepancy. So it's
Paulson.
Yeah, Heather Paulson, right. Well, Heather, it has been wonderful having you on board, and I'm sure our readers are going to get some nice nuggets of information from this, and we're very honored to have you as part of the All Things Cancer community and podcast archives. So thank you very much for coming on today and joining us here and sharing all your wisdom.
My pleasure, and I look forward to this continued relationship and supporting people as they go through their cancer journey. Thank you so much for having me.
You're very welcome, and take care for now and stay healthy.
You too.